Get this thing started right now, and so why don't we go ahead and start open this up with a prayer first. And we have this table. Go ahead and open up with a prayer.
We're going to get there.
Tom, get started. Huh? Getting started.
Started. Ceramic. Let's
So
go. Started.
We're going to open up with a prayer.
Pray with me. Our Father, we thank you for the opportunity to gather, and we thank you for the freedom that we enjoy in this country, and that we can discuss issues that are important to us, and especially to our country. We pray that you'll be with us as we discuss these things and help us to keep an open mind and a pure heart. We pray in Jesus' name. Amen.
Amen. Pledge of Allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Carol, could you come up and do a treasurer's report real quick?
Okay, last month, I'm Bert.
Oh, well,
Last month, we gave $200 to Bert for his recording of our meeting last week, and we collected $30.
We can't hear you.
Collected $30 and gave Bert $200. So our balance now is $747.56.
Okay. And what we'll do is we're going to keep donations going to the DIC. And for those that are live streaming and watching this right now, make sure that you share this to others. It's a bright, beautiful Alaska, beautiful day, and unfortunately we don't have a big turnout today, but please make sure that you share this and get the word out. For those that are on live streaming right now that don't know, AMAC is the Association of Mature American Citizens. This is the Matsu chapter of AMAC Action. We are a conservative senior advocacy organization, and we're here to make sure that our mature Alaskan citizens are taken care of throughout the state. Okay? And so we have two speakers today, although we don't see the second one yet. Dr. Zink is going to give us a rundown on what's going on about what she calls the COVID-19 virus, what I fondly call the China virus. And so, Dr. Zink, go ahead.
Hey, thanks. Thanks for having me, and I can't think of a more important group to be talking to than mature Alaskan citizens, particularly from my home in the Wasilla Valley. So I agree time, and Mike has been asking some great questions and wanted me to come and just talk a little bit about COVID-19 and what we know in the data and science and how it's been changing so that you all have the most latest and greatest up-to-date information. I have a quick little presentation. I'll go through it quickly based on a couple questions that he brought forward. But I also want to hear from you all. What questions do you have? What things have you been wondering about? Questions you've been hearing in other places, and happy to share what we know and what we don't know. So with that, I'm just going to share a couple quick slides here. And so this is just a couple things that put together today. Today's numbers are not up on our dashboard, so this is the numbers as of yesterday. And so if you haven't been taking a look at their coronavirus dashboard, the goal of it is to be as kind of transparent and timely as we possibly can be with the data coming out on COVID. We do the same sort of thing for flu and other diseases, and if you are all interested, I'm happy to connect you to our weekly flu updates and summary reports. We do it for motor vehicle accidents. We do it for other causes of death around the state. COVID has just caught a lot more attention, so this dashboard is people are more familiar with. As we head into flu season and vaccine season, we're kind of talking about are we going to merge the dashboards or we're going to kind of keep them separate. But this is the COVID one. Right on the front, you can see cases by age group. And so you can see that this pandemic continues to be driven by a lot of people in their 20s to 30s. People who are kind of socializing in larger group gatherings, working in different places, tend to have less symptoms, and so more likely to be asymptomatic or very mildly symptomatic, and so may not realize that they have COVID. We did not see these numbers in this direction early on in the pandemic, partially because we were just testing people who were being hospitalized or those who were really symptomatic. Alaska has had one of the most aggressive testing strategies in the country and one of the most tested per nation. And so early on, we started to see more younger people test positive than many other states. And you still see a discrepancy here in our state compared to other states. You can also see our total number of cases. The other things I just wanted to point out is I get a lot of questions about in-state versus out-of-state. We do have to report any Alaskan citizen who dies regardless of what state they died in, but you can, again, we want to be as transparent as possible to you on the in-state or out-of-state, resident or non-resident. So if you click on like the out-of-state resident, over here the cases, deaths, hospitalizations will all change so you can see what that looks like. So again, there's kind of like these standard national ways for reporting that we have to report, but we also want to make sure that we are providing this information again as transparent as possible. So this is the overall report. These are our cases by region. And so you can see red is Anchorage, green is Fairbanks. Fairbanks has been on a pretty significant uptick here recently, as well as Juneau. You can fall active, recover for deaths. The active recovery cases, I would say, are just somewhat lagging behind, partially because of data entry. It takes a while for the team to kind of go through and figure out has someone completely recovered, or we lose them to contact after we've told them they have COVID or want to make sure they're okay. And so this is kind of a harder part of the data, and we've hired some additional data team members to try to get that picked up. So I wouldn't put as much emphasis on active and recovered as just new cases in a region when you're trying to figure out kind of a risk in the regions. Another thing that we look at for risk is the percent positivity, and so this is just the number of tests that turn positive. A couple different things. Each case that we report out, so when we report these individual cases, that's an individual person. So even if someone tests positive multiple times, or they test positive and then negative, we cross-reference that with their birth date and their age to make sure that they're only reported once. And so the test IDs may be different because different testing centers have different test IDs, but we make sure it's just one person. So each of the cases is only one person. That's different than the tests that are positive. That's just the total number of tests positive over the total number of tests done. And these tests are reported based on the data they were collected. And so you'll always see kind of lower testing in the last couple of days because those tests are the tests that are running. And you can also see on our dashboard the turnaround time, how long it takes to get the test back, because we really want to make sure these tests turn around as quickly as possible. And while it's not perfect, it is something we want to be transparent about and try to always make working as quickly as we can to get these back in a timely fashion to not impact people's lives and business, and just give you a chance to know what the test looks like. I think one of the hard things about COVID is that it looks like so many other things. I think of it kind of like an EKG that I do for someone who has chest pain in the emergency department. It's a really useful tool to know if someone's having a heart attack. It's not perfect, and it's done in combination with other tests as well as their clinical history. But it's a really useful test for someone if they're having a heart attack. Very much the same with COVID. It's a really useful test if someone's having fatigue, nausea, vomiting, shortness of breath, runny nose, fever, because there's no clinical symptoms that perfectly matches it, and people can present in such different ways. I do work some shifts still in the emergency department, and I've just been impressed at how mild symptoms can be associated with COVID and how hard it is as a clinical diagnosis. So this percent positivity also gives us a sense of where an area might be taking off. So this was recently, and so here's Fairbanks, really popped up recently. So the percent positivity went up to about 12%. So this makes us concerned there's kind of a big burst of cases happening in that region, and there's been a lot of close contacts. And so based on this percent positivity is where we're kind of move our resources. You can see the map too is the pink here. It went up initially in May, came down for quite a while in April, May. They kind of bumbled along here, and it's actually been staying fairly low. So a question I get asked all the time is like, are we doing enough tests? And the percent positivity is a good way to estimate, are you doing enough tests? You want this less than 2%, because if you're having a big outbreak, you want to do more tests. If your outbreak's pretty well controlled, you don't need to do as many tests. And so this is a way to kind of get a sense of if you're doing enough tests. This is hospitalizations by age, and so you can see that the older someone is, the more likely they are to be hospitalized, but it's not a guarantee for sure. And in fact, less than 50%, only 30% of people over 80 require hospitalization. So you see a variety of different responses. A lot of this probably has to do with someone's immune system and the way that their body responds. And as someone gets older, their immune system tends to react more poorly to COVID. tends to be about a week to 10 days after their exposure and after they first start to get sick from COVID. So it tends to not be right away, but as they continue to fight through the illness, people can get sicker. I think the method and data behind how to treat COVID patients has improved pretty significantly just in a short period of time. And so watching people's oxygen level, there's medications like remdesivir, which is an antiviral, which has shown some benefit, dexamethasone, which also suppresses the immune system. And even just the way that we talk about who needs a breathing tube, who doesn't, the use of oxygen. Vitamin D deficiency is coming up more and more as a major hindrance in someone's overall ability to fight COVID, so making sure that your vitamin D levels are appropriate. We have a lot of people in Alaska whose vitamin D levels are low, can all make a difference in how well you do. I heard a good description recently where they described kind of COVID like a forest fire in the sense that it's really hard to start a forest fire if the forest is wet and if there isn't a lot of dry kindling and it's hard to take off, but it's much easier to get started if everything's dry, there's a lot of kindling, the winds are high. And it's kind of the same way with COVID. If someone underlying has a lot of medical conditions, is older, doesn't have good access to medical care, it's much easier for COVID to kind of take off and make them quite sick compared to someone who's younger or someone whose immune system is a little bit more robust. But it's definitely not inevitable. It also has to depend on how much exposure they have to those lightning strikes or how much exposure they have to COVID will make a difference on if they get COVID. Here's hospitalizations by age overall. So this looks at if you are in this age group, your likelihood to be hospitalized, but this looks at kind of the overall burden of hospitalizations, how many people in the hospital at any given time have been diagnosed with COVID. It's important to note that these hospitalizations have to be related to their COVID. So we've had many cases of people like spraining their ankle and they test positive for COVID. Maybe they're recovering from it or they didn't know and they had exposure. That gets counted as an ankle sprain. That doesn't get counted as COVID. So COVID is only counted for a hospitalization or a death if it has something to do with one of those things. So I get asked that question a lot and just want to make sure we're clear about it. We do ask that hospitals test for COVID upon admission. We do this for other diseases too, like MRSA, and that's a communicable disease. It's a bacterial infection that can spread from person to person. And the reason for testing in it in hospitals is to just make sure that if you're in the hospital for some other reason, you have a low likelihood of being exposed to COVID. That way we know who has it and who doesn't have it so that you are healthy and well. We also really want to make sure people are getting all the other really important preventative care and other medical care. Really early on this pandemic, less so in Alaska than other states, we saw people delaying going in for chest pain, going in for colonoscopies, going in for other really important medical conditions, and we saw people's diseases progress and some people die because of not accessing medical care. So we really want to make sure that people access medical care if they need it for COVID and non-COVID related issues and feel comfortable going in to hospital medical care. And that's a safe place to go. That people are wearing protective equipment and that we know who's got COVID and who doesn't so that it doesn't spread to others. So I just want to kind of really emphasize that point. And have you guys seen this video? This is a little video with blowtorch, and I can play it at the end if you guys want or not want. But I get asked a lot of questions about masks. I think that it's been really challenging with masks, particularly with the messaging early on. They're annoying, they're hot, they're a pain to wear. I think the thing that I've been most surprised by in this pandemic is just how much we've learned about droplet and microdroplet spread associated with masks. As the pandemic has moved on, it's really become clear it doesn't spread as much by things that we touch, mail, groceries, things like that, but how much it spreads just by talking or being in the same room with others in those kind of microdroplet exposures. And how incredibly effective a mask is. They've become politicized, it's been frustrating in so many different ways, but the data behind it is pretty darn convincing on how it not only prevents you spreading it to others, but more and more how if you're wearing a mask, it may really prevent you from having really significant symptoms. So we're seeing that the viral load or the amount of virus you get really makes a difference in how sick you get. So if you get a little bit of virus, you're more likely to be asymptomatic or very mildly ill, versus if you get a whole lot of virus, you're more likely to be sick. And that makes sense with other things, like how dirty a wound is makes it sense that it would be more contaminated and more likely to get infected. But it looks like this is very much the same way with COVID. The more you're exposed to it, the higher likelihood you are. And having a mask on really helps. A surgical mask is about 5 times more effective than a cloth face covering as well. And so I really am just trying to get as many surgical masks out there, particularly for people who are over 65 or who have underlying medical conditions. It can be just a more effective tool. They're also way more comfortable and easier to wear with glasses and other things. We have a whole bunch in the state. The public health department is putting them out. And then I know that Mike has helped get some of the FEMA face masks that are kind of copper impregnated and silver impregnated, and those also work well. Maybe not quite as well as a surgical mask, but they work well. If you haven't seen this video, I highly recommend it. It's probably not totally perfectly PC, but it really kind of shows the effectiveness of a mask. And I think, while it's not perfectly related to COVID, it's a pretty darn close approximation. Again, I'm happy to show it. This was an article that I also found useful. This is from the British Medical Journal. This was on some modeling and kind of talks about, I think we talk a lot in terms of these binary factors like safe or risk, but the reality is life is much more complex than that, and COVID is much more complex than that. And your risk is overall kind of complexly related to if someone's sick and if they're symptomatic and how close you were and how long did you spend with them and what did the ventilation look like. And so this kind of goes through low occupancy and high occupancy settings, being outdoors, indoors, well ventilated and poorly ventilated. And if you're silent, if you're speaking, if you're shouting or singing, and if you're wearing a face covering for a short or prolonged period of time. And so it kind of takes all these factors and variables and kind of puts them into these buckets of green, red, and yellow overall. If you're going into the grocery store for 15 minutes, it's pretty low exposure, but you might just walk through a plume of virus that someone just coughed into. So when I go into the grocery store, I wear a mask to minimize the risk to me and to others. But if I'm, sitting in a patient's room for a prolonged period of time, they've got COVID, even if I'm not doing an aerosolizing procedure, I'm wearing an N95 mask and eye protection because that's just a higher risk closed environment exposure in general. While I'm talking to you all, I've got Zoom and other things, I'm not wearing anything, or if I'm out for a hike with my family, I'm not wearing anything. So it's kind of about choosing that right level of protection for the right level of risk. I also think of it kind of like wearing a seatbelt and airbags. Mask is kind of like a seatbelt, and it helps to protect you. It also helps to protect others. And if there's a lot of community spread, it's kind of like going 100 miles an hour down the road. It's really, really important. If we have very little community spread, then it's probably a whole lot less important. It doesn't really matter. So some of our communities that have not had COVID in months, they're not wearing masks, and that is probably just fine. But if we've got a lot of COVID spreading in a community, that's where a mask is going to be a more useful tool. And I'm happy to kind of talk through some of the data and science with any questions about that one. And this is just another study that I thought I would share. This was recent. It's called an MMWR. These are called morbidity and mortality reviews. They're oftentimes association studies, so they're not causation. So they don't say that this 100% proves it, but they look at kind of underlying risk factors. And in general, this one showed that if you went to restaurants and bars in the past 2 weeks prior to being diagnosed with COVID, you're more likely to be diagnosed positive. So those who were tested, those who were positive for COVID were much more likely to be at a restaurant or bar. Probably just because people have their masks down because they need to eat and drink, more likely to be in enclosed spaces and for more prolonged periods of time. So this kind of red, yellow, green things that we've seen before we see there. Interestingly, things like shopping, public transportation was a little bit all over the place. Church and religious gatherings was like a huge variety, but none of those crossed over the confidence interval. The only thing that crossed over that confidence interval to stay was statistically significant were bars, restaurants, and coffee shops. So I just wanted to share that other data information. Oh, and then the last thing I just want to share, I get asked this a lot, and I think it's a great question, is kind of deaths and deaths related to COVID and what's from COVID or with COVID or how is it counted or that really wasn't a death and what does that look like? It's interesting, as a medical professional, I've been filling out death certificates for my whole career. The death certificate process is definitely imperfect. It's really based on a clinician's judgment. There's 4 lines on it, and you can write what you think the person died from. So it's very rare that we ever write one condition on there. Someone gets hit by a car and instantly dies. Sometimes you'll write 2 there. You might say, I need a cardiopulmonary arrest, meaning their heart and lungs stopped, and motor vehicle accident, and that's what you write. But you probably wouldn't write that they had hypertension or obesity or cancer, because that had nothing to do with that death whatsoever. They just got hit by a car. Same is true with COVID. Someone gets hit by a car and they have COVID, it would be listed as motor vehicle accident or maybe motor vehicle accident and cardiopulmonary arrest. That's very different than someone who gets COVID and then develops pneumonia and then develops acute respiratory lung disease and then develops kidney failure and then has acute cardiopulmonary arrest. And so there you might list 4 things on there. You might list COVID plus all those other things. When we list it, when CDC lists it, when the kind of overall death reporting lists it, we look through all 4 of those things. And if the clinician thinks that they were all in any way related, and we list it as a COVID related. But there's a huge variety in that. So we've had a fairly young people with very few, no underlying medical conditions die. And the only things listed on their death certificate are COVID, and things related to COVID, like underlying lung disease, heart disease, that then resulted from COVID. But we've also had a lot of people who have been in hospice or end-of-life care and then got COVID, and the clinician felt like while they were very sick and expected to die, this was the tipping thing that kind of tipped them over the edge. And we see this all the time with like influenza and urinary tract infections, where even minor infection can be the precipitating event that can lead to that person's death. And so we do the death reporting for COVID in exactly the same way that we do death reporting for all of their diseases. Most of the time, hospitals report them to us. Occasionally, death certificates come to us via this death certificate reporting process. That's how we get a lot of the out-of-state ones. If we have any questions at all, we usually send it either back to the state or that clinician and say, we just really want to make sure you're clear that you feel like COVID was a participant, was one of the things that causes person's death. And if they say, yes, we do think that, then we list it. We, as state government, are not here to second-guess clinicians' judgment, and we're just here to provide, transparent and honest data about what we're getting back in. So that's how we report the deaths. And that fits into a little bit on this report that came out from the CDC on, this kind of quote that 6% of deaths are only from COVID. And what this was 6.6% of the death certificates that had anything listed on COVID only had COVID listed. So if someone had COVID and they then developed acute respiratory lung disease or pneumonia and then died, even if they were otherwise healthy, that might have been listed 2 things, and it might have fit into this category of 1 or more contributing causes. Say they had hypertension, and then the doctor felt like that was also related, that would be 1 or more contributing causes. But COVID affects the kidneys, the brain, the heart, the lungs, and so oftentimes it's more than 1 thing. It's a lot of things all put together. And so it's not surprising at all that 33% had 4 or more causes. So I don't think this study really tells us like how many of these people were on hospice and were kind of expected to die and then had COVID versus were very productive members of society that were doing very well prior to getting COVID, and they got very sick and died from COVID. I don't think this study tells us that question at all, which I think is often the question people are asking. The other question I get asked all the time is, well, aren't hospitals paid to list COVID on the death and to do the state's pay? The state does not pay anyone to list COVID as a death. In fact, we try to really kind of clarify the data and make sure that it's true and honest. There have been CARES funds for hospitals that had a slight increase in how much they paid hospitals for COVID. That was really to buy personal protective gear, as well as to make sure people who were uninsured had access to treatment. And so there's been a lot of questions, well, are we over-reporting COVID deaths? And there's been a couple different studies that have looked at it. And in general, the data has come out saying that we're probably way under-reporting COVID deaths rather than over-reporting COVID deaths. Probably not true as much in Alaska, partially because we just really have not had that many COVID cases compared to most other states. We have the lowest death rate in the state, or in the country per capita from COVID, and we're the most tested in the nation per capita for COVID. But particularly in states early on, there were just a lot of people getting sick, and it's, again, as I mentioned earlier, it's a hard diagnosis to make, and there was very limited testing. And so people were dying of lung disease and pneumonia, and that was being listed on the death certificate, not COVID. So in general, there's been excess mortality, or meaning more deaths than we would predict for that time of year in many states, particularly the East Coast early on. That has come down now, and we don't see excess deaths around the country overall now. So that's great to see. And we have never seen excess deaths in the state of Alaska. So we always look at kind of these trends. And we don't have any evidence that we had excess deaths early on or anywhere through this process, and continue to follow that closely. Interestingly, we don't have excess deaths from suicide, we don't have excess deaths from heart disease, we don't have excess deaths from pneumonia, we don't have excess deaths from influenza, we don't have excess deaths from COVID. When we look at all those numbers, which we kind of follow closely, because our goal in DHSS is just the health and well-being of Alaskans. So anyway, those are just some questions that I get a lot, and wanted to have a few minutes to take some time. And then always welcome people to come to our echoes. We have 17 different meetings and echoes. I'm one small person in a group of people all trying to help figure out how to keep people healthy and well in the state. And we have a science echo every Wednesday from 12 until 1. We now have a vaccine echo that's coming up and about. We have healthcare echoes. Just so people can learn from each other, and we can have a two-way dialogue about what's happening across our state and support each other. So with that, I'll pause and would love your questions.
Anybody got any questions? Now's the time to ask. You got the expert. Cheryl?
You can tell me, like, you don't believe it. Like, tell me what you guys think. Like,
Yeah.
let me know what you're thinking.
Here's a question that, if a person comes down with COVID and they're not hospitalized, they're hanging in there. What's the home treatment methods that they can use or expect so they can get through this bug while they're at home? Because I know that remdesivir, that's IV, that means hospitalization. If you could touch on that.
No, you're totally right. So most people are home. Most people don't need hospitalization. It really depends on someone's symptoms. So, someone who's very asymptomatic or mildly symptomatic probably doesn't need any treatment. They're fine. Ibuprofen and Tylenol are okay to take for the fever, and so that is okay to take. Oftentimes people have nausea and vomiting, so making sure people stay really hydrated is super important. We do send people home sometimes with a pulse oximeter so they can keep an eye on their oxygen saturation. So particularly people who have underlying heart and lung conditions, having a pulse oximeter at home can be an important, good little tool to have to keep a check on your oxygen level. Because sometimes this causes a lot of inflammation of the lungs, and your oxygen level can drop before you really feel short of breath, and we want to get back into the hospital to get on oxygen. That's a difference in how well people do. The Providence system has been using a heart and oxygen monitor that they've been sending home with patients, and then, like I said, the state has purchased a whole bunch of pulse oximeters that we've given out to public health nursing, as well as the emergency departments around the state to send people home with a pulse oximeter to kind of keep an eye on it. If people's oxygen level starts to run low, pronation can make a big difference, and that's basically like laying on both your stomach and your back. And the idea behind it is when you lay on your stomach, it gets your heart off your lungs and makes more space for them. And that's actually made a really big difference both in hospitalized and non-hospitalized patients. So being able to keep up and moving and rotating around, not just sitting in one place. We know this is true with, fractured ribs and other lung diseases as well, but particularly with COVID, it seems to play a really big role in helping to protect the lungs. So we'll encourage people to have tummy or kind of lay on their stomach and also get up and move around to help keep those lungs nice and healthy. Making sure people's underlying health conditions are doing okay can also be real important. So making sure blood pressure is controlled. Vitamin C and vitamin D, particularly vitamin D, has been showing more and more benefit. And so really encouraging people to check their vitamin D levels and making sure they don't have a deficiency and taking vitamin D supplementation if needed to make a difference. Treating, again, someone's got underlying kidney or heart disease, making sure that is well controlled. Sometimes most primary care doctors will prescribe other medications. Sometimes we can get a secondary bacterial pneumonia. So antibiotics work well for bacteria. They don't work as well for pneumonia or for a virus. And so things like azithromycin, doxycycline can sometimes be written for and given. There's been a lot of questions about hydroxychloroquine and if that has benefit or not. I think it showed a lot of promise early on in some animal studies associated with it. There are some people who may benefit from it, but the data has really been pointing towards that most people really don't benefit from it, and there's been some harm associated with it. The state hasn't regulated or controlled hydroxychloroquine at all, and we really encourage people to talk to their primary care doctors because it can be risky, particularly if you have underlying heart conditions and or your electrolytes are off. People can get what's called prolonged QT and can have worsening cardiac symptoms, including cardiac death. And so again, in an effort to do no harm, we really want to make sure that you're kind of making those decisions in combination with your primary care provider. From a state perspective, most of this is decided between you and your primary care provider. We just want to make sure that the resources are there with your primary care provider and you to be able to do what's best for your individual health. And that's really different for each individual person. And the main thing we've been doing on that line is providing kind of that monitoring and pulse oximetry so people have access to know kind of what their vitals look like at home, particularly with that really important one. Does that make sense? Any other questions about that?
Question.
Yeah, go ahead.
So you don't recommend hydroxychloroquine?
I recommend that you talk to your primary care doctor about it because it's a complex drug. And to recommend, I wouldn't recommend any one drug for anyone for anything. There's a whole variety of kind of risk benefits that you have to do on an individual basis.
If you don't have a primary care doctor,
your individual health.
If you don't have a primary care doctor, just pop some of those pills. You don't recommend that?
Well, it's a prescription only, so you have to see a doc anyway.
How did it work?
For hydroxychloroquine?
Yeah, it's
It
prescription.
is prescription
Yeah,
today?
it's
Yeah.
prescription, by
I thought I could
prescription.
get it
No,
now.
by prescription only.
Yeah.
Dr. Zink, the next level though is, okay, so we talked about in-home care.
It's a long time.
What can a person expect if they end up being
The doctor
hospitalized?
told me some.
I'll take it from the standpoint of a 68-year-old male that's got no prior medical conditions like myself. So what can I be expecting?
Yeah, so early on in this disease process, the average length of stay in the hospital was about 10 to 12 days. It's now 4 days. So in general, you can expect that your hospitalization is shorter than it was at the beginning of this pandemic, because we learned a lot about it in a short period of time. Most people, when they require hospitalization, just require oxygen. And so it's just supporting your lungs with some oxygen until your body's kind of able to heal. Likely be started on remdesivir or recommended to start it on remdesivir. Again, that's going to be up to your primary care doctor or the hospitalist to make that decision. But that's an antiviral medication, and so that one works best when it's done early because it helps to prevent the virus from replicating. So that one is best done in that situation. And most people with oxygen for 2 to 3 days, and then they're discharged home. That being said, some people get sicker, and then the kind of pronation that we talked about earlier. And then if people are getting more to ICU level care, then that's when we're talking about things like dexamethasone to help kind of suppress someone's immune system so it's not reacting in the same sort of way. The best studies for treatment have been in dexamethasone, and that's been the best study, the best evidence. The second best study and evidence one is the remdesivir. There is some evidence for convalescent plasma. Convalescent plasma is kind of an old school medicine drug, and it was essentially the turn of the century. And the idea behind it is to take someone's blood who had the disease and kind of clean it out and give it to someone who now has the disease. You're kind of essentially giving them the antibodies to that disease. It's had kind of a bit of mixed reviews, but in general looks to be usually helping someone's underlying medical condition. But again, you want to make sure that you're looking at other things such as their ability to clot or if they've had previous clots in the past and what their heart function looks like because it can cause volume overload. So that may be another option that's given in hospitals. All of those things happen in the state of Alaska. We have been fortunate that we've had remdesivir for any patient where a clinician asks for it in the state. That's definitely not true in most other states, and so people need access to that. It's there and accessible. And then people get sicker, they can end up in the ICU. And so then people in the ICU, it's usually because of the lungs or kidneys. That's what results in them being in the ICU. And then that's when things can be much more prolonged. We do have some patients who've been weeks now in the hospital in Alaska in the ICU, and it's just kind of really prolonged hospital care where kidneys are supported by machines, lungs are supported by machines, and those can be just heartbreaking, can last a while. Occasionally people will need what's called ECMO. ECMO is a very aggressive form of treatment where basically you take someone's blood out of their body, you filter it, and you oxygenate it, and you pump it back in. It essentially works like the hearts and lungs. We don't have the ability in this state to do ECMO for patients. And we've read about it a lot in the news. We've never had the ability to do ECMO, and that would be something that would require a transfer to Seattle. We have not had anyone who's needed ECMO, but that's been in the news a lot. And so just want to make sure people know what we do and don't have in the state. But most people, it's oxygen for 20 days in the day.
Hi, Dr. Zink. I have a question. To your knowledge, do you know that anybody that has been tested positive for COVID, has there a history been done on if they were ever on hydroxychloroquine? For example, my sister who has lupus has been on hydroxychloroquine for a long time and has helped her with her symptoms. I'm kind of thinking maybe she's not going to get COVID, no matter what, if she wears a mask. Does that make sense?
It totally makes sense, and it's a great question, and that study has been done.
Okay.
Yeah, it's been used for lupus, and the people who are on hydroxychloroquine for lupus and other meds had the same risk of getting COVID as those who didn't. So unfortunately, it didn't actually be protective. And there was another study done with healthcare workers who were exposed to COVID, and they gave hydroxychloroquine preventively and did a group of placebo versus a group who had it. And there was no difference in who ended up getting it in kind of that higher risk group with healthcare workers. So unfortunately, there was a lot of promise early on, and unfortunately the data in those two groups isn't panning out to show protection.
Okay, all right. Thank you very much, and thank you very much for speaking with us today.
No, thank you. Thanks for the questions. I wish the data was different. I wish I had something else to share, but it's just what the reports are coming out looking like.
Go ahead.
I have a couple of questions for you. If we were to, as most people like myself, we like to crunch numbers, and we got approximately 730,000 people living in Alaska, and we take who has been infected, and we'll just take the 7,000 people out there approximately that have been infected by the virus. That means that we have had a 99.99% unaffected part of our population. The number grows even substantially larger for the percentage that has not been affected. If we go for the worst case scenario, we get into multiple zeros into the percentage before you even get to how many people have had the worst case scenario. We have areas like the Matsu Valley currently at the moment that has been pretty much mask-free since the start of this. Very, very little mask wearing, yet we've had some of the lowest numbers per population that have been infected by this virus. But then you go to places like Anchorage, and we watch the numbers skyrocket. Are we supposed to be thinking that the virus itself, going by the 99.99% that has not been affected, should we actually be as closed down as we are? I understand that the governor's got, 5 mandates that are in place right now of his own. None of them are as elaborate or involved as what you see happening in Anchorage. Yet Anchorage has had those that we would consider the most vulnerable, the ones that we should be making sure are protected no matter what, the senior centers that have had infections going to them. And then here the most recently, the homeless population, which was supposed to be, we got to make sure that they stay protected, and yet here's a cluster of over 100 people that have now been infected in the last 30 days. Are these mandates really working? We're looking at the extremes of the mayor is doing in Anchorage compared to what is happening out here in the valley. Valley's not seeing no infection rates skyrocketing through the roof, but where these overly extreme mandates, closures, and everything else are happening, like in Anchorage, Juneau, Fairbanks, places that have forcibly made you wear masks no matter what, we're seeing the largest outbreaks. Why is that occurring? If masks are so great at keeping away the virus like they are claiming, why are the places that are forced to wear masks having the biggest outbreaks, yet the areas that are like the Matsu, who you can virtually walk into just about any store, any place, and not wear a mask, not seeing other people wearing masks or not?
Yeah, so a lot of great different points in your question there. So I'll try to break down a couple of them. So one, I appreciate numbers as well. A couple different things is that's kind of the prevention paradox, right? Just because you haven't seen it doesn't mean it's not going to come, or doesn't mean that all of the work that's been done by many Alaskans in the state to try to prevent it doesn't mean that it hasn't happened. So if you look at the death rate, associated with, the Navajo Nation, in New York, in many other locations, it's dramatically different than here. And it's because I think a lot of Alaskans have done a great job of and staying 6 feet apart, washing their hands, and doing what they can to minimize it. So I think it's hard to look at the numbers just in the past and project those forward and say, well, we're fine, this is what the numbers look like. And that's why we really try to learn from the rest of the state and the rest of the country and other places to say, okay, what does it look like and what are the risk factors? I think the more spread out people are, the better off we are. And that has been clear since the beginning. So Anchorage is a little bit more challenged, and New York's way more challenged than we are. Right? We don't get on subways to go to and from places here in the Matsu, and they do. And so your ability to spread it in a small confined space is going to be much harder. It's also harder to get an epidemic or pandemic under control when it's in a bigger city like that, because you bump into a lot more people. And I think we see that in the more densely populated areas in the state, just like we've seen that in the more densely populated areas of the country, that it is harder to control as it gets going much more quickly and can spread much more quickly. And so we see that in Anchorage. I get that question asked all the time, like, okay, is this mandate worth it? Is it not worth it? Look at what mandates are in place right now. One essentially allows us to get reimbursed by the federal government from FEMA for the work that's being done. So there's a lot of money tied to that one. And really helps to just make sure that testing is available and accessible within it. And it has to be done, that's the congregate setting one, that's just essentially to make that happen. The second one is with healthcare providers and essentially requiring masks and requiring a test upon admission. And so that's Health Mandate 15. That one has been written in combination with the medical boards with us, and they're planning to kind of take that one over. And that's just kind of a bridging step of just really good healthcare in general to minimize the spread of what it is. Another one is on the fishing industry, and again, that one is kind of been a bridge as the fishing industry has been kind of catching up and trying to make sure that they don't have large outbreaks. We did see large outbreaks in the fishing industry this summer, but we could have seen so much worse. So you look at the Dakotas, you look at Kansas, you look at Minnesota, the meatpacking and poultry outbreaks were really impactful and caused a lot of COVID deaths and caused a lot of people to get sick with COVID. And we unfortunately have been fairly fortunate this summer with the fishing industry. We had about 50,000 people come from out of state, as well as many state workers living and working in close confined settings that were really hard to mitigate COVID. And when we had outbreaks, they weren't nearly as bad as they could have been, and we had so we've been trying to keep as much industry and business going as we can while keeping people healthy and well. Our biggest outbreak came on a fishing vessel that a lot of people got sick, and essentially they came into port because they were too sick to do their work. So it wasn't that they were being tested for some other reason, but they just had a lot of sick people who needed medical care. And so they came in and we found a really high attack rate. About 80% of people, 75% of people on that boat had COVID at that time. It did require some hospitalizations. So, the goal is to keep them out and fishing and to keep people active and healthy and doing their business. But those mandates for fishing are really to kind of keep those workers healthy so that they can keep doing their business. And moving forward, and then the travel mandate, and that one doesn't require quarantine, and it just really is to provide Alaskans with a test to identify cases. We see somewhere between 30 to 50 positives a week coming in from people who are coming into the state and test positive. Also, we see that now that most people who come into the state have to have a test 72 hours prior to coming in, those ones, we don't know how many people change their plans because of it, but we did see a big decrease in people positive with COVID not coming into our state once we required the 72 hours. So again, it's just knowledge is power. If you know that you've got COVID, we'd like to have people to know before they come into the state. So in general, the mandates have been tried to keep to an absolute minimum to just minimize the impact and risk. If you look at other economic studies and data, if people are healthy and feel safe to go to businesses and stores and to do things, then they're going to do it, and the economy rebounds quicker. And so our goal is to keep people healthy and safe so that people can live their lives and to provide just information so people can make those choices individually. So I think the mandates that we have are kind of, those are in the governor's discretion. Those are at the kind of where we're at right now with those ones. But I would just because you've never been in a car accident or been hurt by a car accident doesn't mean it can't happen. And just because we haven't seen a lot of deaths from COVID doesn't mean we don't learn from other states and other places of what could happen. And we do everything we can to protect ourselves. And the biggest thing I think we can do by that is testing if someone has early symptoms so that we can just have visibility on the disease so you know you have it so you don't spread it to others. And if we don't have a lot of COVID spreading, things like masks don't really make a big difference. If you don't have COVID in a group of people, you're not going to spread COVID to a group of people. And so the more we can keep our numbers down, the more we can just do our normal life without having to worry about COVID. And so I think that's what we're seeing. That's what we saw for a lot of the summer. We have really low COVID numbers. People had a lot of get-togethers and gatherings and saw very little spread. But it's kind of like glitter, once it's open in a closed room, everyone's got a little bit on it. It spreads super fast. And in these outbreaks, I'm just impressed at how contagious it is. And again, I see families, where at a funeral, one person has it, and then many family members affected, and now we're going to another funeral. And the goal is to provide the information and resources so that you can make the decisions that you want to make to stay healthy and active, and know about this virus and the tools that we have to mitigate it. Does that kind of answer your questions?
It kind of does. I guess I'm still a little confused though, because when you get the homeless population in Anchorage, and I'm going to bring up that shelter, we had over 100 people that have gotten it. We've heard over and over and over again from the mayor and the assembly that the homeless population is the most vulnerable. They got to spend $22.5 million of the COVID CARE Act to buy all these new buildings to protect the homeless, and yet here's an outbreak of over 100 people inside the homeless population. and from all appearances, they did absolutely nothing to protect the most vulnerable to be able to allow that kind of an outbreak to occur in those type of environments. I know that you're on a level that's on a state level, not a city level, which makes a big difference. But when we got people like the mayor and the assembly who have preached since day one, the homeless population is the most vulnerable, and so I'm just stepping away from the seniors here because they haven't done too good of a job there neither. But when it came to the homeless population, they had no outbreaks, nothing was happening for the longest period of time. Here we are in the heart of summer, so to speak, and they're locking them all into a building in a confined space saying, oh, we're not going to test you, and they didn't start the testing until much, much later.
We got to wrap up.
Where's the protection for those people? I mean, we're just not, I'm not seeing it, not from what.
Yeah, and Dr. Zink, as kind of a caveat to that, we heard this from, who was it, Governor Cuomo in New York, or it might have been Comrade de Blasio, that 66% of all their COVID outbreaks or infections were people that were in lockdown. So that's kind of what.
That's what I'm
you're
getting
saying.
at, yes.
Yeah, so if people are being forced to lockdown, they're the ones that are getting it, whereas the people that are out and about aren't. So that, if you could just, well, we're going to wrap it up, because I got my next speaker here.
Yeah. In general, being out, it's why we never close trails. That's why we never close the outdoor space. Like, being out and doing things and outside and separate from others is hugely successful in minimizing COVID. So it's been great seeing Alaskans enjoying the summer and being out and about. A couple different things. When you look at a study that looked at long-term care facilities and elders in the United States, no matter how well they ranked for infection control versus not infection control, they all got COVID, all based on what sort of COVID was circulating in that community. So if the community had a lot of COVID, it got into the long-term care facilities. If they didn't have COVID circulating, it didn't get in, regardless of what the facility did. And I think it just speaks to how incredibly contagious this disease is and why our best defense is just keeping our overall numbers low, because it becomes so hard to control once you get in. We saw that with Pioneer Homes, we saw that with the long-term care facility. I will say that the Pioneer Homes, the long-term care facilities, and the homeless shelter have been testing on a very regular basis, and we've been testing way ahead of even CMS regulation and guidelines along that to try to identify cases. We actually got called out nationally on that TCC outbreak on transitional care as one of the fastest outbreaks to be able to be suppressed and to end quickly and minimize hospitalizations and deaths. So I think that there's a lot of work along those lines. They have been testing the homeless population since the beginning, but that population tends to struggle with both substance misuse and abuse as well as mental illness, and tends to be incredibly transient and very hard to kind of figure out where people are at. They're not locked into any setting. They do have housing that they can put in for people who are positive, and there is quarantine options for them. But we have been testing that population since the beginning. The community has been leading that charge. They have the health department there. We're there to support them with resources. They actually asked for additional help, and as of this week, CDC and HUD are in state helping them with that outbreak right now to kind of minimize the outbreak and kind of get that under control. And we're also working on testing guidelines with all long-term care facilities and senior centers in the state, trying to make sure that our resources are really prioritized to people who are higher risk for hospitalization and death, and making sure that they can have visitors tested, that the staff can be tested, to identify cases really, really quickly, and to make sure people are healthy and well.
Okay, thank you, Dr. Zink. I want to close it out on this, as just as and you're aware of this as well. When it comes down to the vaccine that's coming up, Dr. Zink was talking about these echoes. At 3 o'clock, the second Wednesday and fourth Wednesday of the month, we're going to be doing echoes on vaccine. And one of the things I brought up at this last one was, are they interacting with senior organizations like Commission on Aging, like AMAC, like AARP, like senior centers? I've gotten a point of contact. I contacted that point of contact, and we're hoping to have input as far as who gets the priorities. Because right now they were talking, I think it's more of a national we were talking, was that the priority is going to be the essential workers, the doctors, nurses, EMS, first responders,
I heard the same thing.
and then it will be those are the most vulnerable. The question still remains is, because you're 60 and above, are we considered most vulnerable? Or is it going to be 60 and above with XXXX medical issues? And then it's going to be us. So, because the big issue right now is we got 139,000 plus seniors in the state of Alaska above 60. So that's being worked. The state's working with Dr. Zink's been involved in it. I'm injecting to be involved in it. So we'll be keeping you up track. Thanks, Dr. Zink. Thanks so much for being here and doing this. We really appreciate it. And,
Yes.
Knowledge is power.
Knowledge is total power, and I appreciate the questions, I appreciate the math, I appreciate all that. I would say one thing about the vaccines, we also have our science echo, and that one's gonna cover kind of science vaccines. There are 7 vaccines we're tracking right now, and some of them may be more effective in people who are older, and some of them may be more effective in young people, and they have different kind of profiles, and so that's the other thing is we just really need to have the science and data behind these to be able to have good recommendations. We don't have all that yet, so a lot of the meetings right now are on planning and distribution and making sure we have -80°C coolers in different places and the right needle sizes and things like that to make sure we've thought through all the logistics while we're waiting on the science and data. So as soon as we have that, then we can act on it.
Okay, thank you.
Thank you. Have a great day, guys.
Weekend.
Yeah, you too. Thanks, guys.
Thanks, Doc.
That's exactly right.
Bingo.
If you guys want to take a 5-minute quick break, or we can just go right into
Let's go right into it.
it.
I think you guys ought to beat me up whenever you want to. So I'm sorry I'm not in a yurt and participating by Zoom. I'm happy to be here in person and get to see you.
This is Brett Huber,
How do you say the last name?
Huber.
H-U-B-E-R.
Oh, I thought you were Peter.
Oh no, so Peter Zoyas is one of the co-chairs of my group,
Oh, okay.
and he's a very active senior advocate and senior from the Kenai Peninsula. He lives in
Oh,
Anchor
okay.
Point. So we wanted to share that letter with you. He's actually sending out to all of the senior groups, all of the senior publications, and all of his big senior mailing list,
Oh.
because you all are the backbone of how we defeat something as nefarious as what those folks are trying to do in this ballot measure.
Right.
So, how many in this room vote? Show of hands.
What was the question?
How many vote in this room? How many of you vote?
Oh,
You know what? Every last one of you. And if I asked super voters if you knew who that was, you'd put your hand up too. How many of you remember the first time you ever cast a vote? Yeah, me too. So, big deal.
So did your guy win that first time?
Yes.
My guy lost.
Well, Tom, we'll sit down after this and I'm going to give you a little campaign advice, okay?
His name was Nixon, and I wanted him for president.
Well, you got him, just not when you tried to. But you got him, so you're pretty effective. I guess you're a visionary, Tom. That's what I'm going to say. So, all kidding aside, this ballot measure is a mess, right? So you're the people that have. You know, I come out here and the first thing I should say is thank you. This is coming back home for me. As I was telling Tom, lived in the Valley for years. First got involved in politics. I was a fishing guide in Talkeetna. When I first got involved in politics, when I realized if we're not involved, people do to us. And if we are involved, we get a say in the measure. And the most basic say that I believe we all have is our right to vote. And for 250 years, and the entire time you all have been voting, you've had the same system. If the winner wins, and you understand who you're voting for. This new system changes all of that.
So I'm going to refer to a couple notes if you don't mind. I'm not a great public speaker, but I really care about this issue, so I want to make sure that I get my facts straight, and I'm sharing good information for you all. So the first thing you need to know is what this ballot measure does. So this ballot measure takes a primary system where currently we have an open primary on the Democratic side and a semi-open primary on the Republican side, right? So you know when you go to vote in the primary election, you can pick one ballot or the other if you want to help make Republican Party choices of candidates for the general election or Democrats. You can't take both, but you can pick one or the other. If you're undeclared, unaffiliated, or belong to any other party, you can pick those other ballots. You just can't, Democrats don't get to pick Republicans, and the Democrats say, if you find anybody that you want to vote for, you can vote on their side. But it's an open primary system. They're saying it's this horrible closed primary system, it's got to be changed, and what they would like it to change it to is the same thing California and Washington State use. Those are the only two states in the union that have adopted what's called a jungle primary, California and Washington State. Right, so the jungle primary says everybody that wants to can put their name on the ballot, but you don't get to say what party you are. If you want your party affiliation on a ballot, right, because sometimes, so I'm a Republican. We have Republicans, Democrats, Independents, Libertarians, we have all of those things on the group. So I'm a Republican, so sometimes, and I try to be up to speed on my candidates, but if I have a race to pick in, and I don't know that candidate very well, I'll tend to pick the Republican candidate because I share those conservative viewpoints. Doesn't mean they're right, but they're mine. So I can look for a Republican. In this new system, anybody that wants to gets to appear on a primary ballot, and you don't have to say, actually you're not required, you don't get to say what party you're with unless you petition to have your party affiliation shown by your name. So you're gonna have maybe 8, 10, 12 people on a primary ballot. You're not going to know who are Republicans, who are Democrats. 6 of them may be Democrats in a heavily Republican-leaning district. Every one of them may be Republicans. I don't know. But what happens then, you cast your vote, and the top 4 vote getters go to the general election. They could all be Republicans. They could all be Democrats. They could all be Green Party. They could be a mix. But you won't really know. So one of my first fears is, if we can't identify with parties and with philosophies and issues we care about, then why are we voting, right? We vote to pick people and support folks that we think are going to do a good job for us and represent our viewpoints generally. So now we have 4 people on the ballot, and the way this works is you don't get to just pick the guy you want to win or the lady that you want to win, and then if they get the most votes, they win, and they're your representative or your senator or your local assembly member or mayor or any of those things, right? So the way it works, the way it would work under this system is, if you pick the guy and your guy doesn't win, he's not out of the race yet because somebody else may have picked another person. So you pick the guy you want to win, the person you want to come in second, the person you want to come in third, and the person you want to come in fourth. So it's like betting on a horse race, way more than it's like an election, right? So what happens is, if I pick somebody and they got the most votes, but it wasn't 50%, and I only pick that person because they're the only person in my race, right? Or somebody else only picked that person because they're the only person in their race that they like, then they're done voting. So then they go to round 2. So if I picked a second place choice, then that second place choice gets added to the first round of ballots. And then if I picked it, so if nobody's at 50% yet, even though the guy I liked and the guy you liked still in the lead, then they go to the 3rd round. And that 3rd round takes everybody's 3rd choice and adds those ballots to whoever may have been in the race, right? So what it does is take the idea of one person, one vote, and the idea of whoever gets the most vote and wins, and throws it in the garbage. Quite frankly, throws it in the garbage. And you're left with what's going to be a race towards the middle, towards milquetoast, towards people that don't want to take a stand. I mean, I've done campaigns for a long time. So Kelly Good, it's about to be Kelly Huber, that's going to happen in a week. So Kelly Good will tell you that we're both have been in the political business for a while. So if I was advising Tom, you as a political consultant, and didn't know that you might have all of the votes you needed to win, I'd say, Tom, don't make anybody mad during this race. Don't tell anybody what you really believe, just be a nice guy. Be the guy that comes in second instead of first, because the second place guy or the third place guy under this new system might win. So anybody that's brave enough to take a position to identify themselves with a party or something like that is punished. If we pick our one candidate we like and they don't win in the first round, our vote gets thrown away. In San Francisco, they use this method in San Francisco, by the way, another great place. So in San Francisco in the 2011 mayor's race. Yes, that's the place, you got it. In the 2011 mayor's race, 27% of the votes cast, so almost 1 in 3 people, or 3 in 10 people, 27%, right? 3 in 10 people, nearly a third of the votes cast in that race didn't count. People went to the polls and voted, but because their candidate got in this funny horse race rank system thing, their votes got thrown away and didn't count to the outcome of the election. So just for that reason, this is horrible, right? And now let's get to why it's really bad. Because it sounds good. They're Alaskans for better elections. They're going to run $3 million worth of radio and TV ads saying, do you want to get rid of dark money and is Juneau broken? We have a better way. Well, when I have something that works really well and somebody comes and tells me, hey, this is a better way to go, I'm probably more like you, yeah, I'm okay with the way I've used. But especially young folks, and especially folks that haven't been that engaged, right? They are always looking for better, which is why their vote yes on 2 for better elections. 3 months ago, you know what the name of their group was? Alaskans for Better Elections. They changed the name of the group. What did they drop off? Alaskans. Why? Because they have $3 million and 96% of that $3 million came from outside billionaires. They have no Alaskans, right? No Alaskans, except for the ones that are going to be fooled by the slick ads. So that's why I'm really thankful for the opportunity to come out and talk to you today. So what are a couple other things you ought to consider as we're thinking about this ballot measure? They've got more money than we do. They started a year earlier than we did. But we're real. We're an actual campaign. We have co-chairs, 30 of them now, that range from Johnny Ellis, a 30-year Democrat senator, to Sean Parnell, our former Republican governor, to Mark Begich, former Democratic senator, to folks from rural Alaska. We have Dick Randolph, the first libertarian ever elected to state office in the United States, is one of our co-chairs, because he believes that this system will make it impossible for small parties like libertarians, right? Because it will. It's designed to take the power away from us and give it to the billionaires that are funding this. Because as they tell you, well, dark money's bad. They have $3 million, it's all dark. I don't know where it came from. So they're using dark money to convince you that dark money is bad. And worse than that, if this passes to solve dark money, it doesn't affect them. 2 years from now, they can come out and do a ballot measure, use their same billionaires, use their same $3 million or new $3 million, and change something else on us, right? What it'll affect is groups like nonprofits that are politically active, chambers of commerce, some senior groups, right, that are politically active. It will make you have to report every contribution that you've received from a group, and then you have to somehow trace back to who the individual wage earner was, where the dollar was created. So it's impossible. Basically, it takes you guys out of the action. Leaves the billionaires free to run loose. So what kind of billionaires are we talking about? We're talking about Catherine Murdoch, right? Rupert Murdoch family, couple bucks. So they're not trying to just change us in Alaska. This is us being a part of what they want to do to our nation, right? They want to control our vote and not let us control our vote. Why do I think that's true? Am I just making this up? Well, Mr. Kendall, Scott Kendall, is representing the other side of this issue, the ones that want to take your vote away and give it to the billionaires. And he said, these are well-intended people. Catherine Murdoch just cares about climate change. And she doesn't believe that she can ever get her way on climate change if you got Republicans and Democrats to work with. She needs people in the middle. He said that at a debate. I have the clip. So I'm not guessing what their motives are. Their motives are to decide for us what we ought to do. What matters for us as Alaskans. It's for you folks that vote every time, and then a number of you, I'm sure, either served in or know people that served in defense of our country and our basic constitutional rights. If you don't care about the right to free speech, the right to associate, and one person, one vote, this is a great ballot initiative. If you care about these things, this is the worst ballot initiative I've ever seen. Right? It just attacks our basic constitutional foundation, and it gives our control to outside billionaires to do what they want with our state. It is horrible. I can't convince you. I can't say enough about how horrible it is. So who are we? Let's talk about, a little bit about who are we. So John Sturgeon, a senior, a wonderful gentleman, a hunter. I got to go with the governor and do a wounded warrior hunt on a Fall Jack Island last year. John Sturgeon is the salt of the earth. He's a World War II vet. You don't never know that talking to him because he doesn't talk about what he did. He's just a guy that always stands up for what's right. He's our chairman. He went to the Supreme Court to defend Alaskan rights to use our waters not once but twice, and won unanimous decisions both times. That's the only time that that's happened in the history of our Supreme Court. John Sturgeon is a personal hero of mine, and I think truly an Alaskan hero. He's our chairman. Our first three contributors, our top three contributors that you'll notice on the disclaimer when you get down to the bottom of that letter that passed around, are John Sturgeon, Sean Parnell, and Mark Begich. Generally, you don't see Sean Parnell and Mark Begich agreeing on a whole lot, right? But they both know this is bad for Alaska. So here's another couple groups that you don't hear agreeing a lot, right? People have very strong feelings about whether there's a right to life or a right to choice, right? So you have both right to life groups, you have the Planned Parenthood groups. Both of those groups say no to this ballot measure. When is the last time those groups agreed? So Alaskans know this is a bad deal, but they know that they've got a bunch of money and they're going to try to convince you through advertising. So the most important thing you can do for me is you can share what you've learned today, you can continue to learn on this issue, and you can share it with everybody you know. Please tell folks, you got to be a no vote on ballot measure 2. If you care about the state, if you care about your constitutional rights, if you want your right to vote to stay in place and you want your vote to matter, you have to vote no on ballot measure 2. Don't believe their ads. They make it sound good. Hey, we're going to fix Juneau and get rid of dark money. I'm not going to swear, but I'm going to say BS. Right? Just straight out BS. They are not going to save Juneau. What saves Juneau? We send people to Juneau that represent our view. And if they come back and they haven't represented our view, you know what we do? We unelect them. So they're using this last primary election where you saw some of those people in Anchorage from both sides of the party get beat.
Boy.
Because they said one thing and did another. Right? So the idea is, and they're saying this, those people shouldn't have gotten beat. They were just trying to do good. And now they get punished by the people that sent them to office. I'm sorry, that's crazy. I look at an election, every time somebody comes and asks you for a vote, it's a job interview. Right? It's a job interview. They all work for us. Some of them forget that, but they all work for us. The ones that forget it, we vote them out, we find somebody that we think will work for us again. This will make that impossible. Right? Your choice just goes away. So I've talked a lot. I'll tell you a little bit about who we are. We have...
The length of, you've got to at least tell them how long the...
Oh, the ballot measure
ballot
is
measure.
25 pages long. It changes 74 sections of Alaska law. It basically takes our entire election system and throws it in the garbage and replaces it with this thing that I don't know that anybody's ever read. They certainly didn't have them available for signature signers to read 25 pages. Well, there's a reader. We've got a reader here. I heard you did Politico?
Politidic.
Politidic. Awesome. You and I got
Speaking of being, we've got Representative Jason Green right now who is posting comments on my feed saying that you need to vote for this, vote yes.
Certainly. I would guess so. Jason didn't like the way his election turned out.
I read those actually last night. I follow him.
So, I'm sorry, Jason. You're on the wrong side of this issue, and if these people in this room and I do my job, you're not going to like the way this one turns out. It matters too much. Alaskans have to have control of Alaska. This crazy system only exists in one other state, Maine. Right?
It's been turned down in several others, right?
Well, they're trying to get it on a few more, so we'll get to that. So it exists in Maine right now. Just Maine. Ranked choice, jungle primaries in California, but they actually passed ranked choice voting. This is a good one. The California Legislature passed ranked choice voting as a bill. Right, a bill where people actually get to read the 25 pages and get to comment on it and get to work through the process and have public hearings. All those things that didn't happen with these 25 pages. So they passed it, they sent it to Governor Newsom, right? California Governor Newsom, you know what he did?
He vetoed.
Yeah, and you know why? Here's what he said when he vetoed it. I want to get this right, okay? Because I'm quoting the governor. So what Governor Newsom said when he vetoed this crazy ranked choice voting system in California is, and I quote, Ranked choice is an experiment that has been tried in several charter cities in California. Where it's been implemented, I'm concerned that it has often led to voter confusion and that the promise that ranked choice voting leads to greater democracy is not fulfilled. So the governor of California vetoed this because he realizes it's too crazy of an idea.
It's surprising for him.
Right, so I know that Jason is a proponent of this issue. I know that he's one of the original signers and gatherers of the petition. I know he's on the other side of this issue. It's my job to make sure that I'm giving you the best information I can, and y'all make your choice.
What's the difference between jungle and this?
So jungle primary, that's just the primary piece. So they took three pieces, right? So let's start. So the worst evil of all of these three pieces are ranked choice voting. But they knew if they just brought ranked choice voting forward, Alaskans would say no. Done. So what did they do? Well, let's add in this concept of jungle primary, and we'll call it an open primary, and we'll claim that currently Alaskans are barred from voting in the primary, and this will give everybody a chance and bring more people out and increase voting and increase candidates. It's not proven to be the case in the two states where it's been used. They'll claim it has, but it's not. It doesn't work. But the only state that's adopted RCV is Maine. And then the other piece they added to it is the dark money piece. Remember the piece that I said will make it harder on individual candidates and organized nonprofits? But it'll leave the door wide open for these billionaires to come in and use their dark money, right? So they've added that. So what sounds good, wow, the money is dark, we can fix that, and more people will vote, right? That's their message. So they took three pieces together. If this would have been legislation, it would have been three bills, because there are three topics, right? So the Attorney General and the Lieutenant Governor said, these are three topics, they shouldn't be together. So they rejected the petition. These folks paid Scott Kendall. I don't know how much of it went to that. He's made $200,000 so far, being the other side of me in this conversation. Right? He's an attorney, former chief of staff to Governor Bill Walker, which is crazy, right? Because Governor Bill Walker is an independent. This guy worked for the independent, and he's saying independents can't win because the party bosses control Alaska. I mean, it's honestly, it's just crazy. It's honestly crazy. So 25 pages that nobody's read. They took the three and put them together because two of them sound good, even though they're not doing what they say. And the other one's the nasty tasting thing, right? That's the medicine that they try to wrap in their sugar, and that's exactly what their ads are gonna look like. None of it's medicine, it's all poison. It just is. It just is. So we've got 30 co-chairs from around the state, right, that represent all these parties, that represent different areas of the state, that represent different demographics of the state, different age folks, different party affiliations. They're just Alaskans, like Kelly is, like I am, right? She was born and raised here, so she gives me that all the time. I have a 574. I said, you're an accident of birth, dear. I chose to come and came as soon as I could, right? But we're all Alaskans. Lots of different walks of life, lots of different nationalities, lots of different political views, but we're all Alaskans. And Alaskans deserve to know that this thing is dangerous. It hasn't been reviewed, nobody's read it, and they're gonna spend $3 million not telling you the truth or staying away from the real effects of this bill. So thank you for giving me your time. I'd be happy to answer any questions. Is there any other ones I missed, Kelly? It's nice having extra brain in the room.
No, the only other thing, I can't remember, what state is it that has that, the instruction booklet is?
Oh, Maine. So the only state that has it is Maine. They passed it 6 years ago. They've been in litigation constantly since then because lots of it's not constitutional. They whittled it down in Maine so it only applies to federal candidates. So what they put together, their 25 pages, is also blatantly unconstitutional. And they know it. I've asked them this question at every debate we've had. They haven't answered it yet. Blatantly unconstitutional. Here's why I say that. I'm not an attorney. Scott is. I'm not an attorney. But I've been reading law for a while, and like you, I understand that the Constitution is kind of our nation's political Bible, if you will, and it trumps all the other things. So our state constitution says, the governor shall be chosen by the qualified voters of the state at a general election. The candidate receiving the greatest number of votes shall be governor. Which means, like it always is,
Straightforward.
yeah, pick who wins, and the guy with the most or gal with the most votes to win. So, and it also says that the lieutenant governor and the governor in this state, as you know, run independently in the primary and run jointly on the ticket. So it changes that too. But basically, there's no way you can apply ranked choice voting to a governor's race, even though they're saying you can, because the Constitution says you can. So that's just one glaring constitutional problem in the 25 pages. You guys have heard this saying before, the devil's in the details. There's 25 pages of details, and they've hidden a lot of devil in there. Right? I'm happy to answer questions. I think I hit on the main points. If you want to go to our website, right, it's also listed on there. It's called Defend Alaska Elections. You'll get to see all the co-chairs. You'll get to see more information. You can stay current. If you have other groups that you'd like me to come speak with that you're a part of, I'm happy to, or one of the co-chairs will. It's not just me. You can listen to people that are good at this, right? Like former Senator Anna McKinnon or current Representative Colleen Sullivan Leonard, who is a co-chair on this campaign, Ballot Measure 2, or Joey Crum from the Valley, businessman who's a co-chair in our campaign, right? Or go find Mark Kryson. The end of the, right? So he's the Libertarian Party. Mark Carson. He came forward and he was one of the original ballot sponsors in 2002 of instant runoff voting, which is entirely different than this. So Mark came out and said, Brett, how do I help you? I think this is horrible. So he's a co-chair that used to like a part of this idea that says putting these three things together and trying to fool Alaskans isn't right, and he's standing up and telling them. So that's what I need. I need Alaskans to talk to Alaskans. We're going to raise money. We're going to run ads. We're going to fight the fight the best way we can. We're pretty good at using campaign dollars. We've done this before, right? And I can't think of anything I've been more convicted on than making sure this issue doesn't happen to us. It can't happen to us. So if you all have groups, have circles, right, that's how it works. You care enough to be out here learning about politics on a nice sunny day. Thank you. Please.
I don't see Robert Coulter here.
So he had to be in Anchorage by 1 o'clock to be at the airport.
Oh, okay. Did he talk to you? He's the head honcho
Yes.
for AMAC in Anchorage.
I
Did
will
he
do
talk
that.
to you already?
Yep.
Yeah,
I'm on their schedule for
They're
October.
scheduled
Oh, okay.
for the next
But
month.
thank you.
Or did you say that already and I missed
I
it?
didn't.
No, but
Last Tuesday night.
Okay.
I didn't. These guys and I just been emailing
Okay.
a little bit, and I hadn't had the chance to meet you. Your name is?
Oh, I'm Faye, and I been coming to these meetings for what, a couple of years?
That's all we've been around.
How old do you have to be a member of AMAC? What's your cutoff?
50.
Is it?
50, right?
For the
Because I started getting stuff from AARP.
If you're
You can be young.
and a conservative.
Our son is 29 and he's a member.
Okay, so so my daughter is 37, so I'm a little bit older than 29.
Our son is 29.
But here's the thing, I get the AARP garbage all the time, and I shift it away. So thank you for being you. And if somebody's got a membership application, I'm happy to join, because I am not a young man.
Or you can do it really easy online.
Perfect. Okay.
AMAC.us.
AMAC.us, got it. So I'll be a member before the day's out. Check me on that. If I don't do that, then don't believe anything I said.
So you're going to be, next Tuesday, you're going to be at the AMAC meeting in Anchorage?
It's actually, no, I'm doing the October.
Oh, I'm the
thing.
second Tuesday.
Yeah, second
Okay, we'll
Tuesday.
see you there.
Awesome.
We live in Anchorage and
Other
we go to
questions?
both meetings.
Excellent. Sir?
How binding is the resolution? Is it law if it passes?
If this ballot measure passes, what will happen is likely the same thing in Maine, that it'll start litigation.
Yeah.
Right, because that's what we need.
Keep the lawyers.
Keep the lawyers. So, but here's the deal. Once a ballot measure passes, whatever's constitutional, it is law.
You're not a member of
for
AMAC?
2
It
years.
is law.
For 2
No,
years,
no,
nobody
no,
can
no.
touch it.
No. Kelly, you need to sign Kelly up too.
Well, you know what, Mike, if you really want to get this done and make sure that I've not lied to you today, give that to her, because she's way better with details than I am.
Just a couple things. Iowa, didn't Iowa use this for their presidential nomination and they still don't know the results? Politidic, yes.
Politidic, you earned your name. So yes, remember the Iowa Democratic Caucus? Right, so it's not even a full, the state goes and elects, it's just people that come to caucus and pick their Democratic candidate for president. Remember that? That's been like a year ago. It seems like 100 years ago already to me. So they did that. It took them roughly 2 weeks to figure out who actually won. you'll see a fun, I can't tease to that because I don't know who's watching on your Facebook feed. But yes, you're right. Nobody knew who won. They announced a different winner 3 different times. MSNBC jumped up and said, "What a mess!" Right? It's the same thing. We can do that to our entire state
They
if
still
we
they
want.
don't have it resolved? Never got it resolved?
Well, they finally decided, and then it ended up not really mattering because it all went to Joe Biden before they got there. But honestly, it took them 2 weeks before they got to the bottom of that thing. It was crazy. So thank you.
And Alaska's Democrat Party did the exact same thing. They used the ranked choice voting to pick for Alaska's nomination for president. They did it behind closed doors. We, as Alaskans, never got to see the end results of that, other than this is who we chose using ranked choice
So I
voting.
don't know exactly how that went within the Democratic Party, right? Because I'm not a member. And but I'm going to tell you, there's a lot of really good Democrats that we don't agree with on many things, that agree with us on this, that we ought to have the opportunity to pick who runs from our party however we want, and that we ought to have the opportunity to have one person, one vote, and the winner win. Kelly.
So to that gentleman's question though,
Mhm.
any ballot measure that passes.
Oh yeah, I was going to get there, thank you.
So you do have a constitutional issues which will be settled in court, right, fight in court, but the legislature can't fix anything and can't touch anything for 2 years.
Right, so it's
So
bad law you
whatever
can't
hap-
change for 2 years.
Don't they have to, is it law?
Yes.
It's law.
Does the legislature make the laws?
So in this state, we have a thing called direct democracy. We're one of 21 states. Ours is probably the most liberal. If you want to pick an issue, as long as it's not an appropriation issue, our Constitution allows you to go out and gather signatures and bring it to the ballot. When it passes the ballot, it's just as if the legislature had passed it. It's the law. And not only is it just as if the legislature had passed it, if the legislature makes a mistake, realizes it, they can go back into special session, or they can wait to the next session and fix it. If it's passed by a ballot measure, the legislature is barred from changing it for 2 years. So for sure, the next election cycle, we will live with this mess if this passes and the legislature can't do anything about it.
And then if this were to pass and we had to wait 2 years and we got even worse representation in Juneau because of this, we would never get it fixed.
So the only thing I would change is when you get worse representation in Juneau because of this, not an if, it's a when.
It's a win, yeah.
If this passes, because it makes things worse,
Oh, yeah.
right? I don't know about you guys, I coached kids soccer when my kids were little, right? And I got to coach my grandson's baseball team a couple of years ago in California. She lives in Ventura, so I sent my daughter into the land of Ventura. Why is she there? Because she was with the military, her husband's with the military. Otherwise, they probably wouldn't be living in California. It's not their first choice, but it's where they're serving. So long story short, in California, I'm sorry, Mike, tell me your question again. See, I belong in this group for sure.
That if this were to pass, then in 2 years is the next election.
Right.
So we would have ranked,
We would have ranked choice voting
We'd have
for the
ranked
next
choice
election,
voting for the
whether we
next
liked it or
election.
not, whether the legislature would.
and then we would have.
And then you're gonna have,
worse
and so here's who's
representation.
here's who I fear will be elected under ranked choice voting. Because you can still be a dark money outside group, right? You can, if you got $1 billion, you can make the world go round, right? That's not how it's supposed to work. The way it's one person, one vote is because the guy that has nothing's vote is just as important as the guy with $1 billion. But if you follow the money in this campaign, I'm going to share a couple of these with you. It's horrific. I told you about Catherine Murdoch, one of their donors, right? And by the way, I'll give you links, I'll give you sites, I'll give you exact quotes. Ask the other side to do that.
It's all on your website, is that correct?
Absolutely, and you're going to see more and more from us. So I'll give you just a quick.
It's George Soros.
His buddies.
His buddies are in this.
His buddies. So it's billionaires like Catherine Murdoch, who's a climate change activist and proponent of the Green New Deal. It's Mark Merrill, he's the billionaire California video game developer, right? His company they called it a toxic workplace and ground zero for Me Too accusations, right? You can go online and check this, look up Mark Merrill. John Arnold's a billionaire from Enron who walked away with the largest employee bonus ever Well, Enron burned to the ground. Y'all remember when that happened, right? So he's using part of that money too. Those are the kind of people that want to change Alaska's election system. Ask yourself this question: why? Why do they care about us up here? We have 549,000 registered voters in Alaska. There's 300 million people in the nation. Why us? We didn't ask for it. I didn't hear anybody say our election's broken. I heard people that are mad because things aren't working out the way they want to in Juneau. Well, then what you do is you elect different people and you hold their feet to the fire, right? You don't throw it out, change the system. What do these billionaires have to gain? Why Alaska? One of the reasons they're here in Alaska, they're also trying to do this in Massachusetts and North Dakota right now. They got thrown off the ballot in North Dakota because North Dakota's Supreme Court maybe a little more conservative than Alaska's Supreme Court, right? Maybe. So in Massachusetts and here, why are they coming here? Because there's so few of us that they can spend $3 million and buy an election.
It's a cheap election.
We're a cheap date. I hate to say it, but that's why we get to be the experimental guinea pigs for this kind of thing. Now, they say this is an Alaskan and it was written by Alaskans. Hogwash. Hogwash. This was written by the folks that are trying to change the nation. One of them was on a Commonwealth North call 2 weeks ago and said, why are we in Alaska? Because we need to do this in the nation and we need some examples, and Alaska is a great place for us to start. Why do we need to be the experiment of these billionaires that want to really change the nation and take over the country? We're the smallest. Yeah. We're the farthest away. We don't know a whole lot. We're just a bunch of podunk Alaskans. If we spend enough money, we can fool them. And they have a couple of Alaskans on their side that are trying to help them win by fooling the rest of us. It's my job to make sure that doesn't happen, and I can't do it unless y'all help me. So please share this information with everybody. Share our website with everybody. I hate to do this part because it's difficult, so I'm going to ask, no, I won't do it to her. Kelly's the treasurer on our campaign as well, so she can tell you about how you can make contributions. Here's the thing. Many seniors in Alaska are on fixed incomes and just making ends meet. Some seniors in Alaska are, they're across the board, right? But we're also in the time of COVID where all of our life's been changed and it's been harder to do anything that we want to do. I think you heard a bunch of that right before I started, right? We've been living through this, yes. Right? We're watching riots in the streets across our country. We're watching, it's the craziest time that I can remember, right? I sat with my father here a couple months ago. He's 87. Wonderful man. He is my personal hero. And he said, Brett, he said, you could have told me 10 years ago that this country would look like it does today, defunding police departments, promoting riots. He said, I would have told you I don't believe you. He said, I'm not worried about me. I'm not worried about you. You're old enough, but I'm worried about your kids and I'm worried about my great-grandchildren. This is part of that whole effort to change the way we behave as Americans. It's unconstitutional. It's wrong. It's an attack on us. And it's people from outside that have no business bringing their money here and telling us how to live. That's my opinion.
If you look at history and you look what happened in the late 50s, it's the same thing that's going on today. And the last time, we resolved it in Appomattox.
So the scary thing for me is life is busy these days, right? You have single moms, you have two-parent families, you have, well, we don't either because it's COVID. We don't get to do any of this. We don't even have school. But when we get past that, people are really busy. Not so many people get directly involved in politics, and they're counting on those people that just are turned by the ads, turned by the ads, turned by the ads. So our job is to educate and let people. So you're going to see a barrage. They bought $1.1 million of television to run in our state between August 10th and November 3rd.
On this issue.
On this issue. This group of billionaires, right? Not Alaskans. They have like virtually no Alaskan money. It's all outside dark money from the billionaires I just told you about. So they're going to run $1.1 million of TV between August 10th. So it's running now. It's about to start. It's on the radio. You probably heard it on the radio, right?
Oh yeah.
It's better. It's wonderful.
Yeah.
Daisies will pop out when you vote, right? Whatever they need to say.
It's like
Juneau is broken and this will fix it.
It's like listening to an Al Gross commercial.
Al is gross.
Any other questions? We gotta get shut down.
So that's what I was going to say. Thank you. I've went too long already. I'm happy to come back.
We're going to vote.
I'm happy to come back. What I'd love to have is your help. So if you can spare a couple bucks, Kelly's going to tell you really quickly, you can go on our webpage and hit the donate button. It makes it easy. If you want to write a check, she's our treasurer. She can take it from you.
We're donating, our AMAC Sioux chapter is donating $100
To the group.
to the.
And I need an address, which is on the website.
Yeah, but talk to her. She'll be able to take care of that. So thank you. I didn't mean to go so long. As you can tell, I'm pretty passionate about this issue. And I
Well,
hope
you started late.
And I hope, well, they're a year ahead of us and $3 million ahead of us. But we're going to raise enough money and talk to enough people to win. And we're going to do that because of
Good.
great people like you that are letting us be here and talk to you today. So thank you. Thank you.
Okay,
$100?
one aspect, just what you were saying too, is that this isn't just you guys. This is Senator Sullivan and Don Young. They feel, this is all part and parcel of taking Alaska, because if they can win the Senate, and Chucky Schumer has already said he's going to go knock out the filibuster rule, so then that way they can go ahead and then push for Puerto Rico and DC as states. That picks the Democrats up. 4 Democrats. We will never see a Republican-controlled Senate ever again. So this is all part and parcel. Alaska is maybe not the epicenter, but we're being attacked. I want to close this meeting out on this. This has been on the news quite a bit. The president has been attacked for fake news, calling military losers and suckers. I propose that the likes of LBJ, Jimmy Carter, Hillary, and one must not forget, Biden, Obama, are the true losers. LBJ responsible for 50,000 American dead in Vietnam. American men and women in our nation's uniform. Jimmy Carter cut the military so bad we couldn't fight our way out of a wet paper bag, much less rescuing hostages. Hillary, responsible for Black Hawk Down, cutting what Reagan had fixed, fired off Tomahawk missiles to empty tents to detract from the blue dress. Then Biden Obama, cutting military while sending our depleted troops to Afghanistan and Iraq, not supporting Americans on the ground in Benghazi. President Trump doesn't throw away our troops' lives. He values those lives by getting us what we need to fight and win. If God forbid he sends us into harm's way, they will win. Then get the hell out and then praise and reward those who put it on the line. Fight back to any that try to spread the socialist latest talking point lies.
Where are you reading that from?
That's I wrote this up. This is what I wrote up. So any comments? Okay. For the next meeting, again, share this on Facebook. Share. I know you're going to put it on YouTube. Share it on YouTube. Speaking of YouTube, I got kicked off YouTube for AMAC meetings.
Really?
Yeah, I got called hate. I've been attacked and saying that I've been promoting hate. I have 2 things on YouTube: my Argo trips and our AMAC meetings. So I'm fighting now. Next month, same place, same time. We've got Suzanne Downing. She's going to be coming.
Wow.
Suzanne's going to be talking about pre-election, some pre-election ideas, what's going to be happening, and pre-election analysis, what she's calling it. So that's going to be with Suzanne, and I think there's somebody else, but I can't remember who they are. It just completely put off my mind. but of course my mind's dropping all the time anyway, so what else is new? So that's what's going to be coming up next month. And if there's anybody that you would like to see come for November or December, right under the line, please let me know. Okay? Other than that, have yourself a great weekend.
Good meeting.
All right, thank you all of my fellow Alaskans for joining us here today. Don't forget to like and share this video. Don't forget to click the donate link or go to my website, politidic.com, politidick.com. Click that donate button. Every penny that helps to contribute to expanding our content and making sure that I can make events like this one where we had Dr. Zink and those who were talking about the ranked choice voting earlier. I will post links a little later today with the website addresses for the ranked choice voting in the opposition to what is going on there. And I will also be going through the feed that we have here. I am in no way promoting for better elections, and Representative Zach Fields is a big proponent of making that happen. He wants ranked choice voting. He's upset because of legislators out there that did not make it through the primaries this year. A good example of a race that probably wouldn't have went the way that it did would be Coghill and Rob Myers. If ranked choice voting was in place, we wouldn't have been able to remove Coghill out of the picture there. Again, don't forget to like and share. Facebook squeals on you. If you don't, have yourselves a great afternoon and enjoy this beautiful sunny Saturday afternoon.